As far as communication with autism, so obviously autism is a neurodevelopmental disorder which affects social communication, social interaction. So the very nature of the condition means that their ability to communicate, their ability for social interaction may not be what we'd consider to be typical. Some of the things that we mentioned there, I remember in the dementia section, you were mentioning about eye contact, for instance. Mm-hmm. Obviously, eye contact may be something that somebody with autism can't engage with. And it's recognizing those differences, that just because they're not making eye contact doesn't mean that they're not listening, is something really important to kind of recognize it, and whether they want our eye contact or whether they don't. So with individuals on the autistic spectrum, they can struggle with a few things related to communication. There's a couple of bits as far as pragmatics, which is the appropriate use of language in appropriate situations. So like describing somebody and saying, hey, you're very fat, although it may be true, may be taken offensively if we say it directly to somebody's face.
I don't think anybody would take that non-offensive, to be honest.
Very, very unlikely. Maybe a sumo wrestler, because they work hard at doing it, going, oh, thanks, I've been working really hard. But it's a case of, but then not understanding, well, why are they upset? That is just a sentence. It doesn't understand the context, so that may not be the right thing to say in this moment. Or, walking to a shop going, it's very smelly in here. And that not be a positive for the shop owners and people looking round, kind of not being pleased with it, but it is factually true. So they can struggle with the pragmatics sometimes of when language is appropriate. Yeah. Also the prosody, which is a rhythm of speech. So if I go, don't be silly, exactly the same thing was said, but completely different meaning, completely different interpretation. But somebody with autism may struggle to differentiate between the two. That one I'm joking, one I'm telling off. So they may misinterpret it and go, assume I'm telling them off, even if I'm only joking and playing. And this is where things like humor and sarcasm and metaphors sometimes don't work properly.
No, things are literal, aren't they?
Yeah, very literal interpretation. And that's one of the things when we're looking at improving communication with those on the autistic spectrum, it's say what you mean. Yeah. If you're saying I'm going to be there in 10 minutes, well, then you better be there in 10 minutes. Otherwise you lied. Yeah. So did you mean I'll be there once I've finished what I'm doing? Yeah. Which is what you actually meant.
The people that I used to work with, it was a case of, look, I'll just be a few minutes, or I'll be there in a minute. Yeah. Nadine. And it's like, just give me a sec. Well, the second's gone now, Nadine. Yeah, so you'd have to be very, very careful with your choice of words, definitely.
Yeah. I once told a lad Christmas is just around the corner, and he went running off, got to the corner and then burst into tears because there was nothing there.
That's awful of you, really.
It was, it was. I felt so bad about it at the time. What a
nasty man.
And panicked a kid because I said he had butterflies in his tummy and stuff like that. And it's so easy, the idioms that we use.
Pull your socks up.
Yeah, absolutely. Pick your feet up is another one, like when they're shuffling their feet.
Raining cats and dogs. I've never used that one. I've never used. Yeah, no. It's don't get me wrong. I have met some people with autism that may understand slight humour and slight sarcasm. Of course,
it's a wonderful theory about this, which I think is really useful to understand, and I think it makes a lot of sense. That it's basically that most of us kind of, when we're looking if we're looking at woodland, we see the whole wood, we see all of the trees as a whole, and we see the wood. Whereas somebody on the autistic spectrum, it may be a case that they see the tree, they focus in on the detail. So they wouldn't describe it as a wood, they describe it as a tree. Now, if you look at all the things we've been talking about related to body language and communication, it isn't just the words I'm saying, it's also how I'm saying it, the pace I'm saying it, the body language I'm saying it with, the context I'm saying it, how close I am when I say it to you. All of these are also factors related to communication. So suddenly, if you are only focusing on one part, I miss the whole context of what's going on. And that's the thing, if I'm watching a scene in a movie between two people, and I don't have the sound on, I probably would be able to tell whether they like each other, don't like each other, whether it's a friendly conversation or angry with each other, whether they're familiar or strangers and things like that, without hearing anything that's being said based on certain glances, certain gestures, certain touches and things like that. So I'm looking at the whole picture as a whole. There's an exercise I do where I get people to watch a scene and there's a kind of a dot within the scene and they just have to focus on that dot. And suddenly at the end, I ask them questions about, do these people know each other, like each other? What's kind of going on? What kind of emotions might be experienced throughout this scene? And when you just focus on the dot, you can't answer the questions. So you miss the context and the subtext of everything that's going on.
Yeah.
And I think that's, it must be a very confusing world and a difficult thing to understand.
I can imagine at times, people. Yeah, definitely. In that big wide world out there, we don't make things easy for neurodiverse people.
No, 100%. And we're constantly expecting them to join us in our neurotypical world.
We are, yeah.
Especially like those who are nonverbal, for instance.
Of course,
that our objective is to then try and engage in conversation, get them to use words rather than... But if somebody's on the autistic spectrum and they use pointing or can use picture charts or PECs or an iPad or anything like that to communicate, and that's the way that their brain works best to communicate with others, then why are we forcing them to change? It's like some language we use, isn't it? Like please and thank you. I find that if you really analyze please and thank you, they're very weird constructs as far as who's thank you for the benefit of.
Yeah.
You know, if I give you a chocolate bar and I'm expecting a thank you, that's for me. I'm wanting the thank you, not that you really need to give it.
Well, I'm going to remember this next time you make me a cup of tea. I'm just going to take it.
Say thank you. Yeah. Well, especially this was an interview I had with it. It was a video I watched of an interview with a guy with pathological demand avoidance, which is on the autistic spectrum. And he was talking about that gratitude. It said, like, he feels gratitude at times. If he's asked for something and somebody's done something nice for him, he genuinely feels that gratitude. But if somebody brings him home a chocolate bar, he likes a chocolate bar. It's not that he doesn't like it. He didn't ask for it. So why should he be grateful for it?
And I think this is it with autism as well, isn't it? Sometimes behaviours may come across rude or communication may come across rude. Yeah. It's just a different way of communicating.
100%. Yeah. And I think probably a nice little kind of story to finish off before we just cover on a few tips for autism is I interjected with a situation where it was a lady who had asked an autistic lad a question, which was, she'd just cooked a meal and she said, did you enjoy your food? Did you enjoy your meal? And he then answered, no, not really. And she wasn't happy with this answer.
Yeah.
Well, I worked very hard on that meal and that was very rude. And he just went, okay. But she'd asked him a question, he'd answered honestly. She didn't like the answer. That's her problem.
Of course,
rather than his problem. So then she was kind of going, well, I think you should say sorry. He didn't understand why he should say sorry because he just answered the question as he was asked. And then he showed him, I worked really hard on that. Okay, that's just information. I don't know what you want me to do with that information or why it's relevant. So then we said, say sorry. He said, sorry, just to appease her. But I could tell it was just a sorry, just said the words. But then she said, no, you need to say it like you mean it. So then he just shouted at her, sorry, because it was a case of, well, what do you mean by that thing of say it like you mean it?
Yeah.
So he just said it with more force because it's a concept of meaning something. He didn't have the meaning of it. He didn't really know why he was meant to be doing it. And then she was getting very irritated with the lad because he perceived as being rude and said, would you look at me when I'm talking to you? And that's kind of when I stepped in and said, no, I don't think there's any point in that. So
it's a very pointless conversation.
You asked him a question. He gave you a nice answer. It's a you problem.
Maybe her cooking was bad.
It could have been, absolutely. I had a lot of one of my courses I delivered. He was wanting to be a chef and he came on a food safety course with me. And at the end of halfway through the session, I said, are you enjoying it? He went, no, it's boring. And I was like, there was a little part of me that died inside, but I also had to go, fair enough. I asked the question. I can't be upset with the answer.
Yeah, that's it.
So I think with final points as far as helping somebody on the autistic spectrum.
Yeah.
Be clear what you're saying and say what you mean. If you don't tell them to put the drink on the table, ask them to put the cup on the table. Put things in the right order as well. If you go, can you go upstairs after you finish this? Then you've given it the wrong order. They're going to go up the stairs first. They're not going to do the thing you wanted.
Yeah.
Say things in right. Switch on the kettle after filling it with water. The water needs to go in first. Otherwise, you're going to have a dry boiled kettle. Avoid idioms, metaphors, and dual meanings like key as I mentioned earlier. If the sensory issues, limit distractions, a bit like with those on the autistic spectrum as well. On the with dementia, limit barriers to communication as much as you can.
Yeah.
If they're sensory seekers, so they're wanting lots of sensory information, and I think it'd be good to do a podcast about sensory processing at some point. Then they might want more sensory stuff on. Can we stimulate them by having them fidget toy or something to chew on, or being sat in a bean bag or something like that? So they're getting external sensory information. They might find that they can listen to you better. Give them time to process as well. Don't say something, then say it again, then say it again, then say it again. Just sometimes it will give them a few moments to kind of process the information they've been exposed to. And similar to dementia, one subject, one sentence.
Yeah.
Don't kind of mix it
I mean, I
together.
think we could use that in everyday life instead of overloading people, couldn't we? So one thing at a time.
It'd take a long time to say stuff sometimes.
Would in your world.